In just a few days, one of 5 trauma centers in our state will close its doors for good. WellStar's Atlanta Medical Center has been in business for 100 years. On November 1st, the hospital will be shuttered. Now that will leave the Peach State with just 4 Level 1 trauma centers. Memorial Health in Savannah is one of them. Emergency response crews in Chatham County say they are concerned that loss of one of Atlanta's trauma centers could increase already high ambulance wait times here. WSAV's Daisy Kershaw is in our newsroom tonight with continuing coverage.
Tina, I checked in with Chatham Emergency Services today, and they say since the start of the pandemic, wait times for ambulances have gotten worse due to backups at our local hospitals. And they say today alone, around 5 ambulances were unable to respond to calls due to a prolonged wait.
Yeah, prior to the pandemic, wall time was simply non-existent.
Wall time. It's what emergency crews use to measure the wait time ambulances face after arriving at a hospital. Chatham Emergency Services Chief Operations Officer Phil Coster says it varies day to day. But since 2020, the wait at our local hospitals is way up.
Healthcare has been extremely taxed, very, very busy.
A shortage of nurses and bed space is what's driving the issue nationwide. But now Georgia's healthcare system is losing one of its most critical trauma care centers, leaving emergency teams concerned it'll add to the problem.
The closure of the trauma center in Atlanta has a trickle-down effect in the sense that those hospitals have less resources, therefore patients are going further and further out.
Coster says these staffing shortages are also increasing the number of instances where a hospital is unable to take an incoming patient.
Here within Chatham County, we use a diversion status to make sure no particular hospital is getting overwhelmed, or if a hospital is overwhelmed, to move patients and direct them towards the other hospitals.
This diversion status, Coster says, is becoming a more and more common occurrence in the aftermath of the pandemic.
Every day, at least one hospital is on a certain level of diversion, even to the point where ambulances physically cannot go to that hospital.
According to EMS, ambulances are experiencing a combined average of 14 hours of wait time a day, which Coster says is impacting ambulance response times in our area.
When ambulances are waiting for 1, 2, upwards of 8 hours to relay that patient to the ER, that delays the response to the next patient.
Now Coster says responders are concerned WellStar's closure will put a further strain on resources.
The ambulance system, county, state, and nationwide, is already somewhat of a house of cards. And with WellStar closing, this could be the one that really puts us over.
Chatham Emergency Services says since the start of the pandemic, there's also been a 31% increase in 911 calls. Reporting in the newsroom, Daisy Kershaw, WSAV News 3, on your side.